Culture shapes who we are. It influences our beliefs, values, and behaviors. This includes how we understand and approach mental health. When seeking therapy, it's crucial to have a therapist who understands and respects these cultural influences. Culturally competent therapists create a safe space for clients to explore their concerns. They recognize that what works for one person may not work for another due to cultural differences. Ignoring cultural factors can lead to misunderstandings and ineffective treatment. For example, a therapist who doesn't understand the importance of family in some cultures might misinterpret a client's reluctance to share personal feelings. This lack of understanding can hinder the therapeutic process and even be harmful. By acknowledging and respecting cultural differences, therapists can build stronger relationships with their clients. This leads to more effective communication and better treatment outcomes. Understanding a client's cultural background allows therapists to tailor their approach and interventions to meet their unique needs. In conclusion, cultural understanding is not just an optional element of therapy, it's essential. It forms the foundation for trust, effective communication, and ultimately, successful therapeutic outcomes. Culture profoundly shapes our understanding of mental health and illness. Some cultures may view mental health challenges as a spiritual imbalance, while others see them as a medical condition. These beliefs influence how individuals seek help and engage in therapy. Cultural values also impact how we express our emotions and cope with distress. For instance, some cultures encourage emotional expression, while others emphasize stoicism. Therapists who are aware of these differences can better understand their clients' behaviors and tailor their interventions accordingly. Furthermore, cultural factors can influence the effectiveness of specific therapeutic techniques. For example, cognitive behavioral therapy, or CBT, may need to be adapted for clients from collectivist cultures who prioritize group harmony over individual needs. Recognizing these cultural nuances is essential for therapists to provide effective and relevant treatment. By understanding how culture influences our perceptions of mental health, therapists can create a more culturally sensitive and effective therapeutic experience. Trust and rapport form the cornerstone of any successful therapeutic relationship. However, building these connections can be more complex when working with clients from diverse cultural backgrounds. Therapists must be mindful of cultural differences in communication styles, values, and expectations. One crucial aspect of building trust is demonstrating cultural humility. This involves acknowledging that the therapist's cultural background and experiences differ from the client's. It also means being open to learning from the client and avoiding assumptions or stereotypes. Active listening and empathy are also essential for building rapport across cultures. Therapists should strive to understand their clients' perspectives and experiences through their cultural lens. This includes paying attention to both verbal and nonverbal cues, as these can vary significantly across cultures. By approaching therapy with cultural sensitivity and a genuine desire to understand their clients' unique experiences, therapists can foster a trusting and therapeutic alliance that promotes healing and growth. Section 4. Communication styles and cultural nuances. Effective communication is at the heart of therapy. However, communication styles vary greatly across cultures, and what is considered appropriate in one culture may not be in another. Therapists must be aware of these differences to avoid misunderstandings and misinterpretations. For example, some cultures value direct communication, while others favor a more indirect approach. Therapists who are accustomed to direct communication may need to adjust their style when working with clients from cultures that value subtlety and nuance. Nonverbal communication, such as eye contact, facial expressions, and personal space, also carries significant cultural meaning. Misinterpreting these cues can lead to misunderstandings and hinder the therapeutic process. Therapists should be mindful of their own cultural biases and how these might influence their communication style. By remaining observant, asking clarifying questions, and being open to feedback, therapists can bridge cultural gaps and facilitate open and effective communication. Section 5. Adapting therapy for diverse client needs. Culturally adapted therapy recognizes that no single approach fits all. It involves tailoring therapeutic interventions to align with the client's cultural values, beliefs, and preferences. This individualized approach leads to more effective and meaningful treatment outcomes. Adaptation can involve modifying existing therapy techniques or incorporating cultural elements into the therapeutic process. For example, a therapist might use metaphors or storytelling techniques relevant to the client's culture to enhance understanding and engagement. It's important to note that cultural adaptation is not about simply adopting superficial aspects of a client's culture. Instead, it's about deeply understanding the client's worldview and tailoring the therapy to meet their unique needs. By embracing cultural adaptation, therapists demonstrate their commitment to providing equitable and effective mental health care for all. They create a therapeutic space where clients feel seen, heard, and empowered to embark on their healing journey.